During this time, there are still plenty of people dealing with other medical issues that can be serious. One is breast surgery. And joining us now is Dr. Camelia Lawrence, Director of Breast Surgery at the Hospital of Central Connecticut and Midstate Medical Center. Dr. Lawrence, thank you very much for joining us.
Thank you for having me.
So as a surgeon, what precautions or changes are in place at this time?
Well, at Hartford Health, there's several different things happening on the front line. We've began screening our patients and visitors prior to entry into our facility. We've actually rearranged our surgical schedules. We're actually only doing breast cancer cases. All elective cases have been suspended for the time being. This includes pre-malignant lesions or risk-reducing mastectomies.
Let me ask, are breast cancer patients at a greater risk of contracting COVID-19?
The diagnosis of breast cancer itself does not confer an increased susceptibility to the virus. However, for those patients who are currently undergoing treatment, receiving chemotherapy and/or radiation therapy, they are at an increased risk. They're considered immunocompromised because of the medication they receive and thus more susceptible to the virus.
What about, I wanted to ask you about people who maybe are scheduled in general breast health for a mammogram. What is the situation with that right now?
Our imaging partners, Jefferson Radiology and Midstate Radiology, we've actually suspended all of our breast screening exam. We're still proceeding with diagnostic imaging, so these are patients with known abnormality that needs short interval reassessment. But for now, all the screening exams have been postponed.
And what is your best advice to breast cancer patients? It's such a tough time in a person's life with so much going on and uncertainty. What are you telling the breast cancer patients?
I think we're all trying to get our patients to understand that we're behind them. We empathize, we're here. We encourage them to call with questions and concerns. It's so important to remain calm, and we're definitely advising our patients to stay home, remain sheltered in place. The only indication for leaving home at this point would be to a doctor's visit to receive your treatment.
And let's talk about community support. Well, we've been reporting daily, it seems like, on the outpouring of community support for you, frontline responders, and doing all kinds of surgeries. How does that make you feel with people coming forward, volunteering, making masks, donating food?
The support has been overwhelming. It definitely helps us and encourages those, especially my colleagues who are in the ICU and the ER who are on the front lines. It inspires us to want to continue to do more. This is a profession that we all signed up for, so we're happy to have the support of our community behind us to help us. It's a team effort to get over this one.
All right, Dr. Camelia Lawrence, thank you very much for taking the time to be with us today. We appreciate it.
Thank you.